Enjoy the ride with Crystal Petry. Consulting, so inspiring. Wishing you to.
Hello, and welcome to another episode of 60 Minutes With. I'm your host, Crystal Petry. On this week's episode, we are going to learn all about hospice. And if you are like me, thinking that hospice was for those who are getting ready to pass away, you will find out that you were wrong, and so was I. And here to educate us about hospice, we have the beautiful Helen Bauer and the beautiful Sunny. Hi, Sunny. So Sunny is a dog, and he is the first dog that I will be able to interview on my podcast. So to both of you, welcome.
Thank you. We are both excited to be here.
Yes. So my first question is, what is hospice?
Hospice is a kind of healthcare that is for those who are having a serious illness or they are experiencing what we call a terminal illness, which means they have a limited life expectancy. It's not a place, which is what most people think. There are places, facilities that only do hospice care, but hospice is a type of care. It's a philosophy of care, and it's about quality of life and symptom management and comfort.
I am one of those people who thought that hospice was a place. I thought it was because I wouldn't call them hospitals, like maybe the healthcare facilities.
Right.
That say hospice. So I always assumed that hospice was a place that you take your loved one when they're getting ready to pass away, but that's incorrect.
Right. There are facilities that take care of hospice patients, but almost, I think 90-95% of the care that hospice teams provide is in a person's home.
Is it?
Yes, wherever they call home. It
Okay.
can be a nursing home, assisted living, folks who are unhoused, living on the streets, and people in their private residence, apartments, places like that, group homes.
So is hospice for the people that are passing away, or is it for the people that will remain and you have to figure out how to start a new life?
Actually, it's for both.
Okay.
It's for folks who are dying, who have a limited life expectancy. But hospice is special in the philosophy that we have because we also take care of the caregivers.
Mm-hmm.
And we follow with the caregivers for about a year after their loved one dies. Yeah.
I did not know that.
Yeah. We provide grief and what we call bereavement support.
What? Now, the family members that you support after their loved one has passed away, is that optional for them? Do they get the choice to have that or not?
They do. Everything is up to the patient, up to the caregiver to choose, right, the parts that they want or don't want. So a family member or a caregiver can decide that they don't need that kind of grief support, that maybe they're getting it from another source, and so they can just refuse that part.
And the hospice part for the person that's passing away, is that optional as well?
It depends on which pieces, because we have numerous people on our hospice team, each of them bringing a specific skill that they perform for the hospice patients. So we have a physician, we have a nurse, we have a social worker, and a chaplain. So the nurse is the bare minimum of what a patient could allow in. If you don't allow the nurse to come, then there's really no hospice care. But having the social worker, having the chaplain, that's optional.
Okay.
That is optional. Those are the folks that actually make the visits inside the home. So the physician is working behind the scenes with the nurse and the rest of the team, giving orders, prescribing medications, prescribing treatments, things like that. And then the nurse implements all of that and coordinates the patient's care. But the patient has the right to choose how the care goes and what it looks like.
And the hospice facilities, I'm talking about the brick and mortar buildings. How do people get there? Does the doctor refer them there? Can a person just bring their loved one there to those facilities?
No, they can't just bring them there. There are several different types of hospice facilities, brick and mortar buildings. One of them is what we call a GIP unit, a general inpatient, which is for crisis management, for people that are already on hospice.
Okay.
You couldn't just drive up with a loved one and say, my loved one is terminally ill and I want to enroll them here. There is a process for doing that. The physician has a lot to do with it. There are other hospice houses that care for people who are terminally ill, people who don't have caregivers, for instance. But a lot of that is based on, do they need a caregiver? Do they have a safe place to live where they can live out the rest of their lives? Or are they in a crisis where the crisis needs to be managed? So it depends on the different type of facility as to what specifically is the criteria for them to stay there.
Does insurance pay for hospice, or is it out of pocket?
Insurance pays for hospice. Most of the hospice that's provided across the United States is covered under Medicare.
Okay.
So there's no cost to the patients for that. Private insurance, Blue Cross Blue Shield, Aetna, United, each of those policies is individually written. So for an individual person, they would have to look at their policy and talk to their insurance to see what their coverage is for hospice.
Now, we don't want Sunny the dog to feel neglected or out of the conversation. So Helen, please introduce us to Sunny and tell us about him.
Well, Sunny is a 4-year-old golden doodle. I won't say he's my dog because he's my partner. We are a Pet Partners registered therapy animal team. Basically, I'm the chauffeur and the support person, and Sunny is the person who's going to be working.
Okay.
He is 74 pounds. He's been with me since he was about 8 weeks old.
Okay. And how old is Sunny? Because Sunny is black and gray, or is that black and white?
No, he's got a lot of gray. So he's
Okay.
only 4. He just turned 4 at the end of 2023.
Okay.
But when we got him, he was coal black.
Mm-hmm.
But as they age, according to what the breeder told me, they tend to take on some of the colors of their parents. And so he looks a little bit older because he developed this gray hair. So he's sort of salt and pepper, I guess.
Salt and pepper, that's a great, what's the word I'm looking for? A great description of Sunny, salt and pepper. Now, you said Sunny is a golden doodle,
Yes.
right? So is that a mix between a golden retriever?
And a poodle.
And a poodle. Okay. Now, Sunny is very quiet. If you're listening, you probably don't think we have a dog here, but we do. Sunny is just very quiet. So how did you train him? And it is a male, correct?
Yes.
How did you train him to be so quiet?
He's naturally like that.
Okay.
Thank goodness. Now, he's still a dog, and when we're at home, if there's something outside that bothers him or there's a squirrel in the yard, he will bark,
Okay.
and it shakes the windows of the house because
Really?
he's so loud. He is very loud when he does that.
Okay.
But most of the time, he's just quiet. And, for your listeners that aren't watching the video, he's got his head in your lap
Yes.
for you to pet him, and he's leaning against you.
Yes. And
It's
when
his way of being
Sunny,
connected.
when he came in, he just came right up to me as if we had been knowing each other forever, but you said that was his way of introducing.
Yes, he will. He's never met a stranger, really. Sometimes it takes him a few minutes to acclimate and cozy up to somebody.
Okay.
But most of the time, this is exactly how he is. And he'll lead me up to where he wants to go.
Okay. Now, Helen, you are a registered nurse, but you volunteer with hospice. So how long
Yes.
have you been volunteering?
We just started volunteering about, 3 or 4 months ago.
Okay.
Because we got Sunny at the start of the pandemic, the training took a whole lot longer because we couldn't get into places to practice. So Sunny has been with us for quite a while, but we did not become a registered Pet Partners Therapy Animal Team until, I think, summer of last year, so summer of '23. And then we started volunteering in November.
Have you always had a dog when you volunteered with hospice, or is Sunny the dog your first?
Sunny, this is my first experience with volunteering with hospice.
And why did you decide to bring in a dog?
You know, I don't know how I came to want one, but for years I have said, one of these days I would like to have a therapy animal and be with a team, right? Sunny is my partner, and volunteer with people who are at end of life. And I really thought, oh, I would do that when I retire. And since I got older and my kids have moved out, I thought, why not do it now? You know, and not wait. I want to have the energy for it and have the time for it and really enjoy it. So that's when I decided to get him.
And how do you train a dog to volunteer with hospice?
So you have to have a dog that is trained in obedience skills. They have to be able to sit and stay. They have to be able to stop. They have to have great obedience skills that you train them for to be able to go in and out of buildings, in and out of your car, and be safe with other people. Super important. Things like being around an elevator or a door that automatically slides open, which you see a lot in medical facilities. They have to be able to handle those situations safely so that they are not endangered and that they don't endanger anybody else. Now the therapy part, you have to have a dog that is naturally inclined to do this. What he's doing with you with his head on your lap, this is his nature. I didn't train him to do this.
That's wonderful. And he's so calming.
Yes.
He is very calming, so I can see how, well, not literally I couldn't see, but I could understand how he would be a perfect partner volunteering in hospice.
Yes. He'll bring your blood pressure down. You know, there are physiological effects from having connection with a dog like this. Lower your blood pressure, bring your heart rate down a little bit, slow your respirations a little bit, just a calming effect.
Yes, yes. Now, as a hospice volunteer, have you been in the room when someone passed away, or you and Sunny the dog, have y'all been in a room when someone passed away?
We have not. We have not. The patient we are currently seeing is a person with dementia. And so we are slowly building a bond there, but we have not been. He and I together have not been at a death before.
Now, when you, and I don't know if you can speak to this, how is it when you just by yourself are in the room with a hospice patient versus you and Sunny the dog in the room with a hospice patient? What is the difference?
Well, the connection with the patient and the family is a little cozier. That's how I would describe it, a little warmer when I have Sunny with me. I know I enjoy it a whole lot more because I know that, not that my interaction is limited and they don't get any enjoyment from that, but just Sunny makes the visit so much more enriched. And he's special. And when things are exhausting and people are grieving or they're tired and sick and scared, Sunny is a great distraction because we can talk about him and how big he is and, you know, what he likes to do and how he likes to cozy up to people. And it's a great way to relieve stress, to talk about something that doesn't have anything to do with how you're sick or what medicines you're taking.
And how does Sunny help those that are the family and the friends of those that are getting ready to pass away? How does he help them?
He provides a presence, which is much like what he's doing with you, with his head on your lap. And he makes you feel less alone. When I've had days where I wasn't feeling great about something, or I was upset about something, and he has this way of comforting just by his natural behavior. And I think that's what he does for family members and caregivers.
Oh, that is so good. Now, you spoke about after someone passes away, you continue to do grief management with the family for up to a year. Does Sonny participate in that grief management, and if so, how?
He has not yet. I'm hoping that at some point we will. We do interact with the spouse of the person we have been volunteering to see.
Okay.
And providing the same presence and comfort, and of course there's a lot of conversation that doesn't have to revolve around hospice and being sick. You know, we talk about Sonny and all the things that he does. And so I think if we have the opportunity to interact with family and caregivers like that after a death has occurred, I think that could be really good, and I think this is the kind of comfort he would provide.
Do you think that whenever people are going through hospice, and this is for the patient and the family and friends, the change of subject helps? Because when you're in a situation like that, I feel like all you talk about is doctors and hospitals and medication and passing away and maybe your will and maybe your estate. The change of conversation, does that help as well?
I think so. I think so, because you're weighted down with all this heavy conversation, all those heavy topics that you were naming. And sometimes you just want to come up for a breath of air where you're not talking about all that stuff. Let's just talk about something that seems positive and healthy. Yes, that's unrelated to that. So I think that that is a big part of it. Yeah, just to have something else to talk about.
And Sonny is wearing a beautiful aqua vest that says Pet Partners, Therapy Dog Sonny. So how did he get the vest, or did you just make that for him?
Oh, no, lots of hard work.
Okay.
So the organization Pet Partners is a nationwide organization that trains and evaluates therapy animals. They do all kinds of animals. They do cats, rabbits, llamas, horses, different types of animals. And so Sonny and I did a lot of training. First the obedience piece, and then the presence piece, like what he's doing with you and me. And I did, 22, 23 hours of online training for myself. The handlers, which is what the human is known as, have to do all that training. And then you go to take a test in person, and you're evaluated by a team of 2 Pet Partners evaluators, and there are 3 or 4 volunteers that interact with Sonny. It's pretty involved to do the evaluation. And then they decide whether you're ready to interact as a therapy animal.
Okay. Now, I know you started your training during COVID, so you did a lot of things online. Were you able to go in? I know you had to go in and take the test. As far as the training part, did you have to go in face-to-face at all, or was that part online as well?
I did my training all online. And what we did with Sonny was Sonny wore a vest that said he was in training, so we didn't interact so much with people at that point. It was more about going into places that were open, and of course we were masked. I was masked to do that. And we would go into places that allow an animal to be taken through, that don't have a problem with it. We went to hardware stores, Lowe's, places like that, places that would have sounds that he would have to get used to. For instance, the machines, I guess a forklift that would be lifting and they beep.
Yes.
Right?
Yes.
He has to get used to sounds like that, being startled by doors that open or fans that turn on when you walk in the door. So that way we could evaluate what he needed me to do to keep calm if he got startled or scared. So that was a lot of the training that we did, was just out in the community.
Okay. And Sonny, as you described him, is a salt and pepper golden doodle. How did you come up with the name Sonny?
Well, it's spelled S-U-N-N-Y because he's a little bit of sunshine. And I guess it's a little silly, but yeah, that's where I came up with the name.
I like it. I like it. What has been your feedback from the doctors and the nurses at hospice facilities when you bring Sunny?
Oh my gosh, they love it. When we go to see the patient that we are volunteering with now, this particular patient is in a memory care unit. And we can barely make it from the front door to where the patient is without stopping 10 or 15 times because the staff is there. And Sonny greets everybody. He greets everybody. And they love having him in the facility. He's well behaved, and you know, everybody that we meet talks to him.
When you say memory care facility, what is that?
That is a unit inside a facility that is specially designed with care and safety and staff for people who are dealing with Alzheimer's and dementias.
Okay. Do you and Sunny the dog only volunteer at one hospice facility, or do you volunteer at multiple?
We only volunteer with one hospice agency.
Okay. Now, I have never heard of a dog volunteering in hospice. Is this unique, or is this something that happens all the time?
It happens all the time.
Okay.
It happens all the time. Therapy animals are designed to minister and to care for people. So in hospice, we use a lot of volunteers. That's one of the requirements by regulation. And so someone that has a therapy dog is a great hospice volunteer.
Now, you said volunteers are regulation in hospice. Can you expound on that, please?
Hospice agencies inside the U.S. are required to have 5% of their total patient care hours come from volunteer hours. And these are exactly volunteers. They do not get paid. These are people out in the community who say, I want to visit out in these homes or wherever the patients are to provide support and companionship. A lot of times they just become friends. It's just a friendly visit. And these are people who give up their time.
You are a registered nurse. I would think, and this is just me thinking, I would think since you are a registered nurse, you see a lot of sickness and death already in your everyday profession. Why in your volunteer life would you want to, I guess, experience the same thing?
You know, I have worked in end-of-life care for the last 15 years, and I've been a nurse for almost 34 years. And to experience that end-of-life journey with someone and even be present for their death is oftentimes perceived as being very sad, depressing. And what I have found is that it's very beautiful, and it is a privilege to be able to walk alongside someone as they do this. And if we can support and supply something that enriches it or makes it easier, then that's incredibly gratifying. There's so much purpose and meaning in doing this type of work. So really my choice to volunteer inside hospice with Sunny is just an extension of the end-of-life nursing that I've been doing.
Is that, and the way you described it is beautiful. I've never heard of end of life described that way. But is it traumatizing for you? Is it emotionally heavy for you at times? And how do you deal with that?
It can be very emotionally heavy, absolutely. And I think anybody who works in the field with patients, regardless of what discipline or what job they're doing when they're out there, would tell you, yes, we have days that it's really, really heavy, really heavy. And we experience something called compassion fatigue, which is basically emotional wear and tear as you move from grief event to grief event. We carry a little bit of that patient and that family's grief as we continue through our work. But we handle it differently because we go from person to person to person. And at the end of the day, we have to know how to take care of ourselves. So self-care is a huge thing, and not not the big vacation manicure, pedicure, massage, but the day-to-day stuff. How do you take care of yourself on a day-to-day basis, even on an hourly basis when you're seeing patients? You know, hospice nurses and hospice aides may see patients die 2 or 3 in a day, and there's a lot of wear and tear there. So taking care of themselves is a huge component of doing this well.
Would that be why, because doctors and nurses, when they give you like heartbreaking news or terminal life news, they're very just calm and very, I feel like, stoic when they deliver that news. Is that a form of self-care for them, or is it because they have to deliver that news over and over again?
I think, I wouldn't say it's a form of self-care. I would say sometimes, first of all, we're not that great at delivering that news because that's hard news for anybody to hear.
Yes.
And sometimes we like to maintain a professional boundary that keeps us from getting too emotionally involved in the grief that we are introducing into their lives with this hard thing that we're having to say. And so we want to maintain that professional boundary. I think also we want people to think that they can rely on us. If you are a family member and I'm telling you something very hard, you need to know that I'm not going to fall apart and cry and have a heavy emotional response, because that's not my role in what we are doing. And people need to know that they can count on us to be professional. So I think there's a lot of things that go into how we deliver that news and how we communicate.
As a volunteer in hospice and as a registered nurse, does someone ever get used to people passing away?
You get used to seeing it, but I don't think you ever get to where it doesn't affect you. And to anybody who's listening, who works in end-of-life care, if you happen to be listening or watching, I would tell you, if it doesn't affect you a little bit, then it's time to move on and find something else to do. This work is not easy, but it is special, and it is worth doing.
The volunteer hours that you did online preparing to volunteer with hospice, do they teach you or give you steps on how to handle when someone passes away?
They do. I take that back. I would say that they don't give you specifics about someone passing away, about being present at a death, because the therapy teams that are volunteering through Pet Partners are volunteering in all sorts of situations.
Okay.
Some of them are in schools with children reading to them. Some of them belong to veterans' homes, veterans' facilities, law enforcement departments, things like that, first responder support, Red Cross support. So there wasn't any training that I can recall specifically about being present when there's a death.
We have heard, I know I have heard about how dogs make such a difference in the lives of humans. As complicated as those lives are, and you even spoke about how the presence of Sunny and how the presence of dogs will lower your blood pressure and calm your heart rate. What is it about dogs that has that effect on humans?
I don't know that every dog is like that, because I had a lot of dogs that were hyper and very, very active, and they never lowered my blood pressure. But when you have a dog like this with Sunny, it's so much presence. It's like having a friend to hold your hand.
Okay.
To give you a hug. When Sunny puts his paw up on your lap, that's his way of giving you a hug. And I think creating that connection and saying, I'm here with you. No words needed. No words. You don't have to say anything to him, and he's not going to say anything to you. But that presence is so comforting.
And what is your intention with you and Sunny the dog volunteering in hospice? Your personal intention with that?
I want to be able to add in to the care that people are receiving at end of life. Hospice teams are typically understaffed because there's a staffing shortage across the United States. And they don't always get to spend as much time as they would like to with patients and families. Volunteers really help to fill some of that space. And of course, we don't come in with any agenda. We are not out there to provide education about your diagnosis. We're not teaching you about medications. We're not telling you when to call the hospice team. You know, that's not the job of volunteers. So Sunny and I really have a cushy job, and we just get to be friends. We just get to be friends with people.
That is a great job.
Yeah.
Especially in that situation.
Right.
Yeah, especially in that situation. Now, you spoke that there's a shortage of hospice workers across the United States. Is there a shortage of volunteers in hospice as well?
I don't know that there's a shortage of volunteers, but it's something that we're always having to pursue, especially for patients that live in, say, rural communities where the drive is very long to the hospice patient. It's harder to get volunteers to do things like that. And really, volunteering with someone who's dying can be challenging because people are a little afraid of it. Right? If I were going to tell you, oh, you could volunteer to walk dogs at a shelter, or you could work with someone who has a terminal illness and is dying.
Walking the dog.
Right. People are going to choose something that makes them really feel good about themselves, you know, something that they enjoy. So a hospice volunteer going out into a patient's home really brings a lot of their own heart to the work.
If someone is listening or watching and they're considering volunteering with hospice, what would you say, what advice would you give them to kind of nudge them in that direction?
I love this question because hospice agencies are always looking to educate people about how they can volunteer. They're always looking for volunteers. So if you're interested in volunteering in your community, go to a hospice agency and tell them, I'm interested in volunteering with you. Everybody's doing it. It's a requirement for every hospice agency. Talk to them about what your skills are, what your gifts are, what you'd be willing to do, where you'd be interested in driving. And we also have volunteer tasks that a volunteer could do that are what we call administrative things. So making copies, answering phones, putting together booklets, things like that, making phone calls, things like that for folks who are not comfortable going out into a home to see a patient, if that bothers them, but they still want to give back. But you can call local agencies. You know, if you've had experience with a hospice agency before and you liked the team and their culture of their particular agency, call them and see. There is an application process. So volunteers are treated like employees. That sounds terrible because we don't pay them in hospice. But so there is a background check. You fill out an application. They do recommend that you not volunteer for a hospice agency and work with hospice patients until you have gone past a significant loss in your own life for at least a year. A lot of people feel drawn to hospice, say you have a parent that dies on hospice, and a few months later you think, oh, that would be wonderful. I know what this is like, and I can support a family member or a caregiver. But the emotional grief response can be very intense. So we really prefer hospice volunteers to have gone at least a year after a significant death in their own lives. But yeah, reach out to a hospice agency in your community. It's a great way to volunteer.
Since you have gone through the training, you and Sunny the dog, who's napping now. I hope I'm not boring you, Sunny.
He's a typical dog.
Are you now able to train other handlers and their pets to volunteer in hospice?
No, I don't have those credentials. I haven't gone through like trainer training with pet partners. So that's outside of something I would do. But anytime I have an opportunity when Sunny interacts with somebody, I definitely educate about what we do and what Pet Partners is.
As the handler with Sunny the dog, do you consider what the two of you do as therapy?
Oh, absolutely. Absolutely. It's good medicine.
Good medicine. Oh, that's, you know what, I feel like that's an oxymoron, but it's not, when it, with the
Right,
two of you,
right.
it's not. Let's see here. Now, have you, and I know that you volunteer with hospice, but outside of hospice, maybe family and friends, have you and Sonny been able to help in that aspect?
We have. That's a really, really good question because my father-in-law passed away a few years ago in the middle of the pandemic from complications of end-stage Alzheimer's. And Sonny and I were not a registered Pet Partners team at the time, but of course he was our family dog. So he would go with me over to my in-laws' house or with my husband. And as we spent time there, helping my mother-in-law, my husband was a huge support for his dad. Then Sonny was there. My father-in-law did not really interact well with Sonny. He didn't connect with him well. He had always had small dogs.
Okay.
And I think the larger dog made him uncomfortable, but Sonny was a great support for the family.
And how did he support you in that?
Definitely the presence with us, with me, and with my husband too. And somehow I think he could sense the grief and what we were feeling, the emotional overwhelm. So even at home, he stayed pretty close. Yeah.
What is your short-term, and I don't know if you've thought about this, your short-term and long-term goals with you and Sonny the dog?
Well, I want to continue to build the number of people that we get to see as a hospice volunteer team, and that's really based on the agency. And I want to get more comfortable with going to see somebody that might already have a pet in the home. We haven't tried that yet. Just because starting out I figured we have a more controlled environment so I wouldn't have to worry about Sonny's response. I think he would do fine, but I'd like to learn, branch out to that. And as far as long-term goals, I would like for Sonny to be my partner for as long as he's able to do it. And then when he's no longer physically able to do it, then he just gets to be Sonny the dog at home with us,
Yes.
Now he is a dog at home, right? We take the vest off and he runs and he chases squirrels and he's a mess. But I would like to do that for as long as Sonny has energy and the heart for it.
And how does Sonny the dog, as an animal, does he like the volunteering with the hospice? How does he respond to the emotional part of it?
That is a very, very good question. And I love answering this because the rule as a Pet Partners handler is that my job is to support Sonny while he does the job of connecting with people. So if he seems scared, tired, anxious, if he gets uncomfortable, or say the client or patient that we visit has become rough or doesn't respond well, it's my job to take him to a safe area. If he is nervous, if there's something in the environment, maybe even a scent in the home that makes him uncomfortable or anxious, it's my job to recognize those signs and signals, that's part of our training, and take him out of that situation. So he's very good at connecting in with people very easily, very easily. He goes straight up to people. Sometimes he pulls a little bit on the leash, which is a no-no.
Okay.
But he goes straight in, and I really just follow his lead most of the time.
Does Sonny do anything that lets you know I'm not comfortable in this situation, or emotionally this is too much for me?
Yes, he does. He will not pull forward. He won't go forward to a person. And if he is close to someone who is too rough or petting him, like his nose is sensitive, his snout is sensitive, and if they're too rough with that, he'll raise his chin up and he'll pull back. Okay. And I know in that case to direct that person and tell him, hey, his favorite spot to be scratched is right here on his chest, or he likes to have his tummy rubbed. And that way direct them And that's my way, again, of supporting Sonny so that he feels safe and he feels comfortable.
With volunteering in hospice, right now I know you only have one patient, if you will. Is there a max number of how many patients you can volunteer and help with at a time?
There isn't. There is no number restriction on that. The only restriction we have is he's really not supposed to work more than 2 hours a day.
Okay.
And when we get finished, he's tired. So he gets a little self-care when we get home.
Okay.
Which is a little silly, but he loves to be brushed and, of course, rubbed and scratched. And I do a little bit of massage on his back and his legs,
Okay.
which sounds a little crazy, massage for dogs, but he enjoys it. It's another way we are connected. And I tell him, you did a great job today. I'm so proud of you.
Oh, just like a child.
Exactly.
Just
exactly.
like a child.
He's one of my kids.
Will there ever come a time when you retire Sonny from volunteering with hospice? Or will you both retire? When you feel like it's time for Sonny to retire, will it be time for you to retire also?
I hope he's not listening to this. Don't listen, Sonny. I would retire Sonny out if he began to not enjoy the work or have a poor response.
Okay.
You know, if he doesn't engage anymore, or if he has physical health issues.
Mhm.
We are not allowed, the Pet Partners Organization does not allow us to take an animal in for a visit if they are not in great health, because it's unkind to the animal,
Okay.
right? As far as retiring Sonny and continuing the work, I would say yes, I would do that. I would do that. I would love to be able to do this. Yes, now he picks his head up because he heard me say that. I would love to continue doing this for as long as I can.
Mhm.
And I think my span, my anticipated length of time for doing that will be longer than Sonny's.
Okay. As we get ready to wrap up this interview, I have a few more questions for you. Can you tell me some myths about hospice that people believe to be true but actually are not? And then to piggyback on that question, can you tell me some truths about hospice that people may not know?
Well, we already talked about one of the biggest myths is that hospice is a place,
Correct.
right?
Yes.
That's a big myth that people don't always know. The other thing is the myth that you lose control of all your decisions if you enroll in hospice care. The truth about that is you retain control of all of it. You decide who comes to your home, you decide what medicines you take, you decide what equipment is allowed into your house, like oxygen or a hospital bed. You decide whether you want to be on hospice or not. You decide if you want to come off of hospice.
Okay.
That's all up to the patient or the patient's decision maker. But I think a lot of people think that once you enroll in hospice, you don't have any choices left. You don't get to make your own decisions anymore, and that's not truthful. The other myth that people deal with is that hospice is only for folks who are within days of dying.
Yes. That's not true?
No, that is not true. Hospice is for anyone with a life-limiting illness, but we have patients that stay with us for 6 months, for a year and a half, for 8 months, for 8 weeks. It's not just for somebody who is what we call actively dying.
Okay.
Yeah.
And I know you're going to continue answering my initial question, but for the patients that are there for 6 months or 7 months, what is going on, like what's happening with them?
Well, their disease is progressing. They're not seeking any treatment, nothing
Okay.
curative. So their disease is continuing to progress, and the hospice team supports each of the symptoms that comes up, teaches them about what's going on, and then supports the caregiver.
Okay. And do people ever leave hospice? Like maybe they go but get better? Do they leave hospice?
They do. Sometimes people come off of hospice care. They can choose to come off of hospice care because maybe it's not a good fit for them. You know, that's not where they are and they're not ready to give up treatment. Or maybe they have gotten better, they've plateaued, and they feel like it's not a good fit. Sometimes hospice agencies also discharge patients.
Okay.
If a patient, for instance, somebody with a respiratory illness like COPD, if they have a really bad exacerbation of the COPD, which means they have a flare-up of the COPD and it gets really bad, sometimes they may come to hospice, and then the flare calms down. We get their medicines regulated and consistent. We're providing support. All of the care comes to the patient, so it conserves their energy. They're not having to go back and forth to the hospital or the doctor. And they actually improve. So they may improve to the point where they no longer qualify to be on hospice, and the hospice agency will give them notice that they don't meet the criteria anymore. Here's what we're going to do. We're going to help you transition to a different type of care. So sometimes they beat the rap. They graduate from hospice.
Which is always a good thing.
Yes, yes. I think for caregivers it's a little frightening sometimes because that support that the hospice team has been providing goes away. But it's our job to do the kind of discharge planning that sets them up with another doctor. And here's where your medicines are. Here's where your oxygen will come from. And to get them set up to be successful and healthy going forward without the hospice team.
And what would be, you spoke about qualifications for hospice, what would be those qualifications to receive hospice care?
Well, the first thing is a 6-month life expectancy, which is a decision, a declaration that comes from a doctor. Only a physician can say that a patient has a 6-month life expectancy or 6-month prognosis, is what they call it. They have to be willing to accept it, for one thing. We never place people on hospice care that don't want to participate in the care, right? If you're still seeking treatment and that's your thing and that's what you want to do, hospice is not forced on anybody. The other criteria, you have to show documentation that the disease has moved consistently in a more progressive direction. Things like infections, and of course cancer patients, if they choose not to seek treatment. Multiple hospitalizations, falls, weight loss, just general decline in all the different functioning and the ability to take care of oneself. All of that contributes into the criteria.
Is there a wait list for hospice?
Unfortunately, right now in some areas of the United States, we do have waiting lists. The rest of the country where the shortage is not so bad, we admit hospice patients within 24 hours because our patients don't have time to wait most of the time. A lot of them do come to us very late in their disease, and they only have a few weeks, sometimes as little as a few days, just a week. And so we try to get them admitted very quickly, very quickly. In the last year or so, I have heard discussion of people having to wait, which is heartbreaking.
Yes.
So
could they be transferred to another hospice, like in another city or another state? Or do you just have to?
You have to be cared for by a hospice agency that's in your, what they call service area.
Okay.
So the Beaumont area is serviced by this particular number of hospice agencies, and those hospice agencies decide what area they will drive to. You know, Vidor, Orange, Port Arthur, Woodville, it just depends on how far and how large their service area is. So you couldn't be here in Texas and have a hospice agency that took care of you in Louisiana.
Okay.
Because those folks are going to be driving out to your home to see you.
Now, I know we pivoted a little bit from my initial question. Were there any other myths or truths that you wanted to dispel and discuss about hospice?
There are a lot of myths about the individual roles of the people on the hospice team. One specifically is the social worker. What does the social worker do? Well, the social worker doesn't need to know all about your finances. They're not going to report you to the government for anything. What the social worker does is help you find resources. They also supply grief support, grief counseling. They do family conferences, and they help with advanced care planning, which is, huge when you have somebody who's nearing end of life, advanced care planning. But a lot of people think that social workers want to dig into their personal finances and their personal life, and that's not the job of the social worker. The other role on the hospice team that's very misunderstood, probably the most misunderstood, is the role of the chaplain, or spiritual counselor, as they're more widely known. Chaplains have a reputation for being someone who's going to come in and try to change you, your personal beliefs, your faith beliefs, your spiritual beliefs, your religion, your religious beliefs. So chaplains are not there to convert you, to redeem you, to save you. That is not their job. The personal religious views or faith views of the chaplain don't have anything to do with the care that they provide to the patient. It's all about what the patient and the caregiver believe. And the chaplain is designed, the role is designed to meet the patient and the caregiver wherever they are and support them. How can I support you?
Is that optional? Could the
Yes.
patient choose not to have? Okay.
Absolutely. And a lot of people do, first of all, because of the myth and this misconception about what a chaplain does, but a lot of people also have their own faith support, community clergy, their own priest, their imam. They may have a monk that they stay in touch with. They may have a rabbi that provides their spiritual care for them. So they will say, oh, I don't need the chaplain. But you can have both.
The chaplain, do they work for the hospice or do they volunteer? What is their?
No, those are paid positions.
Okay.
Yeah, physician, nurse, social worker, chaplain, and of course we have other paid positions as well. Our nurses' aides that go out and help patients with bathing, which is a huge component. Those folks work so hard to support and make our patients comfortable. But those are all paid positions. It's just our volunteers
That are not.
that are not paid.
Okay. Well, as we get ready to wrap up, you and Sunny the dog have been so wonderful, and Sunny has been just the most precious and patient.
He got comfortable. So,
Yeah, he did, and that's okay. We learned so much about you, Sunny the dog, so much.
he's a good guy.
So my final question for you, Helen, is who do you think would make a great guest on the podcast? I don't know if anyone's going to beat Sunny, though. This is going to be a hard follow.
That's true. That's true. He's a tough act to beat.
Yes, yes.
I have a friend who works tirelessly in the community. His name is Josh Davis.
Okay.
And Joshua Davis. He is a younger professional man, grew up here in the Beaumont area, and he works for a nonprofit healthcare business. He's an amazing guy. He's been very active with Relay for Life and the cancer fundraising effort here in Southeast Texas, and he would make a great guest.
You know what? I did not know healthcare could be nonprofit.
Yes, there are some nonprofit providers, clinics, where people do not have to pay.
Well, I cannot wait to talk to Joshua and learn about this. I did not know that was possible.
Yeah.
Wow. Okay. Well, thank you, Helen. And thank you, Sunny the dog, for sitting down and doing my podcast. I appreciate both of you.
Oh, it was our pleasure.
And thank you so much for tuning in and watching. You can get this podcast and all of my other podcasts on YouTube Podcasts and Apple Podcasts. And remember, you always have time to listen and learn on the go.
Come on, let's go on a journey. Sit back, buckle up, enjoy the ride.